Dr. K is with us, Dr. Kevin Kavanagh, a retired physician and founder of Health Watch USA. Hey, good morning, Dr. K.
Good morning, Jack.
How was your weekend?
It was very good.
Good. Glad to hear it. Tell us about this Norway study about the long haulers syndrome common in the young. Tell us about that.
Well, again, this goes along with this virus is one that you want to avoid. And the thing that, like you said, is most disturbing is that they found this to be present, long hauler syndrome, in 52% of home isolated young adults. And this was looking at symptoms 6 months out. And the most prevalent symptom was loss of taste and smell in 28%, fatigue was 21%, but also there was impaired concentration in 13% and memory problems in 11%. And as we discussed last week, there's new research showing a direct effect between COVID-19 and actually the brain or the CNS. So this is one of the reasons why, if the Delta variant gets here, and it looks like it will at some point, we've got to think about wearing masks again, not so much to prevent yourself from dying of the infection, but you don't want to get infected in the first place. Why get extremely sick for a number of months, and who knows how long that's going to last, from an infection that can be at least partially or fully avoided by getting vaccinated and by following public health advice.
All right. Tell us also about the latest on the Delta variant. That's a very big concern, I know, in England.
Well, it is. And right now, almost all the cases in England are from the Delta variant. The best information you can get from this is from the Public Health of England. They give out a weekly report on the variants. The vaccines appear to be extremely effective, especially the mRNA vaccines, at avoiding hospitalizations, and 80% effective in avoiding symptoms. Of course, you worry about that 20%. And the thing of vaccines, and I need to stress this repeatedly, is that there's two types of protection. There's a community protection and the individual protection. So the idea is if everybody in the community gets vaccinated, the virus won't spread. It won't be there that much. It may be just a little bit, but it's going to be about gone in the community. So if by chance you get exposed, you have an 80% protection. That's the individual protection. And what we're missing in the United States right now is that community protection. We have far too many people that are not vaccinated, and we need to get those individuals vaccinated. And Jack, I came across a headline today, and this was in the Daily Mail. This is a very conservative English magazine that has been around since the 1800s. They're the outlet that actually broke the story of NIH funding of the Wuhan lab, which was early last year. And they are predicting the United States is, again, going to get overrun by the Delta variant unless we get fully vaccinated. This is a conservative magazine that is not anti-science. And so people really need to take this virus seriously. A few days ago, Dr. Stack in the Kentucky Department of Health noted that 99% of the people hospitalized were not vaccinated. And similarly, 93% of those people who died of the virus were not vaccinated. So really, you need to go out and be vaccinated. And also, you need to remember it also protects others that are immunosuppressed or have an organ transplant that really cannot get a good immunological response from the vaccine. So it will protect you, it will protect others. Over 300 million doses have been given, and they've been shown to be extremely safe. Can complications occur? Rarely. And of course, one or two, couple deaths have been reported, but that is infinitesimally small compared to the devastation of COVID-19. These are some of the safest vaccines that we have ever produced. So I encourage people to get vaccinated. If you're in doubt, contact your physicians and talk to them about it.
I saw this story this morning online, and I thought I got to share it. with Dr. K, you being a retired ENT, ear, nose, throat man. Lady, 45-year-old woman in New Zealand, got a COVID nasal swab test. Ended up finding a tiddling wink she shoved up her nose as a kid 37 years ago.
Well, that's a long time. Usually you have symptoms from that before, before that is found on a COVID test. But that's another, I tell you, that is another advantage of getting a test, is it will detect tiddlywinks up your nose. So,
in your nose.
Yeah.
Have a great week. We'll talk to you on Friday. Thank you.
Thank you, sir.